everybody, welcome to the Hruska Clinic shoe list of 2023. Just going to give you guys some updates, some information, lots of shoes to go through. So I appreciate your time to listen in on this video. I just kind of want to go through some of the mechanics of what we do when we go to walk. When our foot hits the ground, we land on the outside of our foot. We should roll in on the inside of our foot, feel our arch, and feel our big toe. Remember, you have a left foot and a right foot, and so whether you're walking or running, your feet should be doing something different during the gait cycle or walking cycle compared to the opposite side. In our clinic, when we go to look at shoes, when I educate my patients, we want to make sure, A, the shoe is comfortable. If you feel like you have to break a shoe in, it's not your shoe, even if it's on our shoe list. Number two, when you go to look for shoes, when you walk around slowly, when you're walking, you should be able to feel the floor underneath that shoe, that you should be able to feel the heel of your foot, the arch of your foot, and your big toe. So that way you know that your foot is working with that shoe and not fighting the shoe. So as you walk around, can I feel my left heel like my right heel? Can I feel my right arch like my left arch? Can I feel my right big toe like I can my left big toe? Then you can stand in the shoe store, put your left foot ahead of your right, bring your right arm forward like you're going to take a step, pick your left foot up off the floor, and can I feel the whole foot on the floor underneath me, heel, arch, and toe, on both sides. Those are the first three things. Then you could take that shoe in. If it's a comfortable shoe, you can feel heel, arch, and toe when you walk. You can feel heel, arch, and toe when you stand on both sides of your body. Then take that shoe in and let your physical therapist watch you walk in it. And then they're going to make sure that you're neutral with PRI objective tests at the neck, trunk, and pelvis. It's important that your therapist should be watching you walk and doing objective testing with your shoes. They should not just be handing you a shoe list and say, go find a shoe. So that being said, I want to go through some criteria that you guys can also look for in any shoe, whether it be a casual shoe, whether it be an athletic shoe for tennis, for basketball, for volleyball, or for running or walking. And that criteria that we look for in a shoe is that we like toe boxes that bend easily at the toe box. That is the normal bend of your toes in your foot. If you do not have the normal bend of toes in your foot, because sometimes your big toe joint can be fused or maybe have some arthritic changes and you may not have the normal motion of your big toe joint, then we would put you in a different type of shoe, which we'll talk about later in the video. But we want that toe box to bend easily at the normal bend of your toe. That's important because when you go to walk and your foot's behind you, you want that toe to bend, so you can get to toe off, so you can extend your hip and push with your glutes. The second thing that's an important thing is we want you to be able to have the heel counter, that the heel counter doesn't collapse in. The heel bone or the calcaneus of your foot, we want that to be stable so the midfoot or the middle part of your foot can roll out and roll in. Your foot, your heel bone and the middle part of your foot should not roll out and roll in together. The heel should be stable and the midfoot should be the one rolling out and rolling in when you're walking or running. So having a heel counter, if you press back here, this should be firm and this should not collapse in. This third criteria that we look for in the clinic with shoes is we want this heel counter to be symmetrical. There are some shoes on the market where the inside of the heel or the medial aspect of the heel will be built up and the outside of the heel counter will be a little bit lower, so it's asymmetrical. This is built up and this is a little bit lower. Well, what happens is then your foot is going to be on the outside of your foot through the entire walking or running cycle. And it's really hard for your foot to have enough power from your glutes to be able to roll in and overcome that asymmetrical heel. So you want the heel to be symmetrical back by your heel. The fourth thing, is you want to make sure that this heel counter, that if you press down between the heel of your hand and the top of the shoe, you don't want this to give a lot. And if it gives a lot, your foot is going to follow that power of least resistance. Shoe companies tend to make the outside of the heel counter more cushioned because that's what happens when we walk. We land on the outside of our foot. It's okay for a little bit of cushioning, but if it's too much, then again, your patient, or you yourself is going to land on the outside of your foot and be on the outside of your foot through the entire gait cycle. So again, we like toe boxes that bend easily at the bend of your foot, which is normal for most people. We like the heel counter to be nice and firm. We like the heel counter for there not to be a lot of give on the inside or outside of the heel, and we like this to be balanced and symmetrical between the inside and the outside of the heel counter. So every shoe on the Hruska Clinic shoe list will fit that criteria, with the exception of one category, which we're going to go through here in a minute. The shoe I'm holding right now is the ASICS Cumulus 24, and this shoe we really like. It fits all of the criteria. There is a little bit of lateral heel give, and I've had some feedback from a couple of clinicians that they feel like that's too much, and that's okay, you guys. That may not work for that patient, but for someone that's of average weight or maybe a lightweight person that has a history of heel stability, this shoe, the way the design of the heel cup, not only does it not collapse in, but the design of the heel counter actually gives your calcaneus or your heel bone a good heel hug. And that's really important for some of our patients that have a history of ankle sprains or a history of an ankle fracture or heel instability. This shoe has really worked well for those patients. The shoe doesn't have as much arch support, so sometimes it can work really well for an orthotic, or some of your patients might need a little bit added heel sense, arch sense if needed with this shoe, if you need this with the heel or ankle history that they might have. Another shoe that we have really good luck with in the clinic is the ASICS Adrenaline. Again, it fits that criteria. The unique thing with some of the Brooks shoes is that they have this guide rail system that goes around the heel, and it goes over here with the arch, which really allows the foot to have a good heel and arch support to be able to roll in, fill the arch, and push off the big toe. I really like how in the back that there's a different type of material than the front part of the material to really get that good calcaneal support to allow the midfoot to work differently. That being said, there's a big trend with some of the athletic shoes for the bast, or the upper part of the sole of the shoe, not the sole of the shoe, but the upper part of the shoe, to be made out of knit. And when shoes are made out of knit, it's really hard to control the foot to work with the shoe. So we really want the upper part of the shoe to be made out of mesh, because it allows the foot to work with the shoe. So this is a Brooks Adrenaline. It's one of our top shoes that we have a really good luck with here in the clinic. It really works well for most average feet. Another shoe that we also like is the New Balance 860. And the New Balance, for a few years there, was not on our shoe list because the heel counter collapsed in. And they've done a really good job of making this more solid back here. It bends easily at the toe box. The heel counter symmetrical, and it has a little some arch support to allow you to roll in, fill your arch, and push off your big toe. It's similar to the Adrenaline. The difference between the New Balance 860 and the Brooks Adrenaline is that this has a little bit wider toe box. So for some of your patients that maybe have a little bit wider foot or have a bunion, this may feel more comfortable than the Adrenaline that tends to be a little bit more narrow in the toe box. The last shoe that's on our top list is the Brooks Dyad. And again, the Brooks Dyad fits the 4 criteria. The thing that we really like about the Dyad is the liner of the shoe. You're going to see that how it has the bumps back here. And what that does is it's a different liner than the other shoes that I've shown you. The other liner, so this is the one of the New Balance 860, is more of a typical liner where it doesn't have these bumps and it's smooth. Well, the material that this liner is made out of reinforces the patients to be able to push in and work with that, for the foot to work with the shoe with this liner. So if you have individuals that are maybe having difficulty sensing the ground underneath them, I know that that seems weird, but in our clinic we get a lot of people that have upper neck tension and difficulty sensing the floor underneath them. And the Brooks Dyad tends to work really well for those patients that are neurologically impaired of sensing the ground. They feel like they're walking on a cloud instead of walking on a solid ground. So those are some of our top shoes. Let's go through some shoes that used to be on our list that are kind of going to go off of them. This is the ASICS Nimbus, and for a while the Nimbus was a really great shoe to help people that had a really rigid midfoot to roll in. Well, they can completely change the design of the Nimbus. You're going to see how it has a shallow area for the foot to fit in, and look how thick. So it has a lot of cushioning, you guys, but look how stiff it is in the toe box, and the heel counter also slopes up. So it's going to not reinforce a good heel strike. It could be considered a rocker shoe. It might work well for some of your patients, but for the vast majority, 80-90% of your patients, I don't think this is going to be a good match for your patients. This is not going to be on our shoe list. There's also material inside of it with that cushioning. It almost feels like a dense foam that it's going to be hard for your patient to work through their entire foot when they're walking, like heel, arch, and toe. When toe boxes are really stiff and they don't bend in easily at the normal bend of the foot, which a lot of, this is like just like the Hoka. The Hoka is a big rage right now. It was on Good Morning America about one of the top shoes, and you guys, it is a good shoe for some people. But in my humble opinion, those shoes are good for people that have limited mobility at their big toe joint, meaning they don't have the normal bend of their toe. So if they have had a fusion, or they have limitation with arthritis in their big toe joint, then the Hoka or the Nimbus might be a shoe that you might want to look at with them, because it's stiffer here, which will allow them to work with that limited range of motion at their big toe joint to roll through their foot. But if you put someone that has normal range of motion in their big toe joint, like myself and the vast majority of people, and you put them in a shoe that is really tipped at the toe box, what happens is when they're back here and their foot's back behind them, and that stiffness at the toe box is not going to allow them to roll all the way through their toes. So what happens is they're going to have to overwork their hip flexor to pick their foot up. It's going to decrease hip extension with their hamstrings and their glutes to roll through their foot. So now they're, instead of pushing themselves forward, they're going to pull themselves forward with their hip flexor. So just be careful about who you're putting people in. If you're putting people in a shoe that's stiff at the toe box, they've got to make sure that that fits the criteria for a limited first ray mobility at their big toe joint. Another shoe that we have changed, so these are the shoe that's going off. Another shoe that's going to go off the list is the ASICS Kayano. Again, it's really stiff at the toe box. This shoe also has a lot more lateral heel give on the outside of the shoe, and it really toes up here, so it could be considered a good rocker shoe, I guess. Again, if you have someone that has limited first ray mobility at their big toe joint, this could be something you could consider, but that is not, that's a small percentage of the population. And it just seems like a lot of shoe companies are going more towards this, mimicking the Hoka of going with a really stiff toe box. And I should also mention, you guys, with the Nimbus, not only is it kind of coming up here, toeing up the toe, you see how it's going up here with the heel? So see how that's sloping up back here? It's not just ASICS that is doing this. There's other shoes that are also doing this, and with our local shoe company, they're talking about a rash of people that are getting more achilles tendonitis and calf pain, and we're really looking at and researching with those particular individuals to see if they are in a shoe that's not only rocking at their heel, so it's going to limit their ability to get or sense their heel when they're walking or running. And we don't want that. We don't want to get early heel rise when people are walking or running, because then they're going to push to the ball of foot too prematurely. Again, it's going to make them pull themselves forward versus pushing themselves forward with their hamstrings and their glute musculature. So just be on a lookout with that. I know Saucony has some that are doing that as well as the Nimbus. This is the Saucony guide, and this shoe hasn't been on our shoe list for a while. It fits the criteria. The one thing that we thought that this was worth, we're a little nervous about the heel that's coming up here at the back, but it's behind the heel in the shoe. So it's behind here, so where it slopes, it's not where the heel's actually in the shoe. So we're going to put this on the shoe list with a little bit of a question mark. We want to try it out. The reason why we wanted to try it out, you guys, is that this is the only shoe that they've kind of added this reinforcement with this thread going through here. And as you can see how it crisscrosses here. And we're kind of inquisitive or curious if this is going to help that midfoot, to regulate that midfoot when your patients roll out and roll in when they're walking or running. So we thought that this was worth a look-see in our clinic to trial with patients. Would really love to get the clinicians out there your feedback with what you think about the Saucony guide. But they're one shoe that is providing some reinforcement with the midfoot and back here by the heel. So we're curious to kind of try this with some of our patients to see if it might be a shoe that might work well for them in their particular situation. The 880 was a shoe that was off of our shoe list that we put back on. The reason why I went off the shoe list in the past is that the heel counter collapsed in. The heel counter of this, they firmed it up a lot more. And the other thing is this might be one that will also maybe provide a heel hug, kind of like the ASICS Cumulus. So we're going to look at that. But the 880 was a really good shoe for some of my patients to go with their PRI orthotics that a lot of my patients loved and liked. So this shoe's gone back on the list because they've reinforced the heel counter better than what they've done in the past. Another shoe that came back on the shoe list was the Ghost 15. The Ghost 14, they had the first part of the toe box here. The 14, it didn't control the forefoot, so the forefoot would roll over. Where they've reinforced this, that the 15 has been a really nice upgrade. It has good cushioning. They've reinforced the toe box so your foot doesn't over roll in when you're going to toe off. And so we put this shoe back on the shoe list. It might be a good shoe to look at, again, with PRI orthotics, or someone that has more of a rigid midfoot that needs to repronate. So we put this back on the shoe list. Two shoes, we have the Brooks Glycerin and then the Brooks Glycerin GTS. This shoe last year was a great shoe for a rocker type of shoe, but with both of these shoes, the toe box is way too stiff. And it's not a rocker shoe anymore. It's going to go in the category with the Hokas, about a shoe that may be good to look at with someone that has limited first-rate extension or mobility in the big toe joint. So it's not a rocker shoe anymore. They've made the toe box way too stiff. And the difference is you have the Brooks Glycerin and you have the Brooks Glycerin GTS. The Brooks Glycerin GTS, it gets confusing because it has both Brooks Glycerin, but the Glycerin GTS is going to have the guide rail system similar to the Adrenaline, which might be good for somebody if they have limited big toe mobility, but they need a little bit more arch. The Brooks Glycerin GTS might be the shoe you want to look at for your patient, where the Brooks Glycerin doesn't have that guide rail system, but they're both really stiff at the toe box. So you're going to see, you guys, our category for shoes that have limited first rate mobility is big. And that is really a small percentage of patients that need to be in that category. So I kind of wrestle with the fact if we should make that category so big, but just keep that in mind. So I hope that helps. You guys have waited for the shoe list. We always appreciate your feedback. Thanks for tuning in and have a great day.